Hi there. My name is Elisa Tajari. This presentation will discuss the findings of my literature review about the treatments for ADHD. This presentation is for my Psychological Studies capstone course project in Dr. Brown's class. I'm also with Kaiser University. Attention Deficit Hyperactivity Disorder, or ADHD for short, is a mental health disorder, or to be exact, it's a neurodevelopmental disorder that affects many children. They go through life with many struggles because of this disorder. They struggle in school settings, work settings, have troubled relationships, and have low self esteem. These children may also have trouble with impulsive behavior, inattentiveness, and outbursts of emotion. ADHD can begin in early childhood and persist through one's whole life. While we do not know the origin of the disorder, in the last 10 years, the prevalence of ADHD has increased significantly. The most common treatments for ADHD are stimulants and non stimulants. Stimulant treatments are the most widely used. They contain various forms of methylphenidate and amphetamines, which can produce a calming effect in individuals with attention deficit hyperactivity disorder. The calming effect produced is because of the increased dopamine levels in the brain by the medication. Dopamine is a neurotransmitter associated with motivation, attention, and movement. Each stimulant medication is different, though. Some are short acting, some are intermediate acting, and some are long acting. The short acting medications are usually taken 2 to 3 times a day. The long acting ones can be taken once a day or once every 12 hours. One of the most common stimulant medications is Adderall. Non stimulant medications became Food and Drug Administration approved within the last 20 years. They are also not as used as commonly as stimulant medications. They do not work as quickly as stimulant medications do, and these medications would be used more for individuals that do not take well to stimulants or are stimulant naive. The research questions for my project are what treatments are most used for individuals with ADHD? Why are these treatments used the most? And what, if any, upcoming alternatives can be used to treat ADHD? To perform my literature review, I had to look for articles to review first. I searched in multiple databases. The first database I went through is ProQuest. The terms I used were ADHD and treatment. This yielded 32,699 results. Of those 32,699 results, I filtered through each of them by looking for more information about ADHD treatments, and I was searching for an age range for children and adolescents up to 18 years of age. I also performed a search on Google, and I used the search terms ADHD and treatment again. There were over 93 million results. Of those 93 million results, I selected 2 or 3 websites and reviewed the information. To search for the websites used, I ensured that they were government websites by making sure that the domain was a .gov and not a .com. The last database I looked through was Google Scholar. I had to search here because I was having trouble finding treatment specific for behavior, given that most of the resources I looked at before did not support behavioral treatments. So the terms used were behavioral treatments for ADHD. There were 195,000 results. To sort through each of these, I used the same criteria that I used for my ProQuest search. The 3 top treatment types for ADHD are pharmacological, behavioral, and natural or herbal. Pharmacological treatments include those related to the branch of medicine dealing with drugs. These are generally man-made and are widely accepted. Pharmacological treatments for attention deficit hyperactivity disorder are classified as stimulants or non-stimulants. Stimulant medications have shown promising results when individuals diagnosed with ADHD use them. These medications are generally the first option because of the range of studies backing their effectiveness and sometimes their safety. In my review, there were multiple studies that ended up discussing stimulant medication in children. Those outside of their preschool years responded well to stimulants. For preschool aged children, it was recommended that additional research be completed to ensure the doses are safe, uh, and also that discussions with their doctor are made. These medications are advised to be used as an alternative when an individual cannot handle stimulants because of the adverse effects that can occur. In this review, many of the studies of non-stimulant medications included bupropion. Sorry, non-stimulant medications have also shown promise for effectiveness, but they have not shown as much effectiveness as stimulants. The medications are advised to be used as an alternative when individuals cannot handle stimulants. So that's when you would use a non-stimulant. The most common non-stimulant medication that I found in my review was bupropion. The information regarding this medication showed that it's effective, but to watch the dosing again. Although the drug was promising, additional research is needed to evaluate its safety in younger children. There are multiple behavioral treatments, but the most common ones mentioned in my review were parent training, classroom and peer interventions, and cognitive behavioral therapy. Parent training consists of reviewing and strengthening the coping and parental strategies for the parents. This training would involve educating the parent more about attention deficit hyperactivity disorder and how this is affecting their child. When the parent has a further understanding of how their child's brain is functioning or how they are perceiving what is around them, then they can implement other strategies to help. The strategies parents are taught include involvement of social learning principles, rewarding pro-social behavior, and how to decrease unwanted behavior through timeouts or other non-physical disciplining techniques. It's shown that using physical discipline with children with ADHD is actually adversely affecting them and does not help further along. Parent training can be effective, but it requires a lot of time and patience on part of the parent. This is one of the reasons that this specific treatment is not as common, but for those who do not want to use pharmacological treatments, would choose this first. Classroom and peer interventions involve making the environment a more capable space for the child to be able to interact. Classroom interventions involve discussion first with the teacher, if able, and arrangements being made to help work through when the child is having an outburst. This may include having the child step outside or speak with the teacher privately. Peer interventions require instructing the child on how to act and react in social settings. One of the interventions would be discussing problem solving in a social setting. Encouraging social interactions and relationships help children with ADHD in the long run, so those skills are still available. Children with ADHD generally are social outcasts in a school setting, so being able to advise them of peer interventions would help them not be a social outcast and could help their peers understand what they're going through. Cognitive behavioral therapy was shot down in most of the articles I reviewed. This is because of how a child's brain functions when they're diagnosed with ADHD. It's believed that they have a disconnect in their cognitive function, which is why cognitive behavioral therapy or CBT reportedly does not work. However, it was found that when a child is diagnosed with ADHD and depression, CBT seems to be a better therapy. There were many natural and herbal treatments. The most common one was magnesium and vitamin B6. These supplements were found to be very effective when researched. However, additional research does need to be conducted, especially in younger children. With natural and herbal treatments, the argument is basically these are coming up. So natural and herbal treatments are starting to be researched more, but there was not many published results on current research. Much of the research was older. Um, And there are a lot of concerns about safety because, as with most herbal supplements, there may be a toxicity level. And using these supplements in young children may not be beneficial to them in the long run. So we do need to study most of the supplements that are listed and then see how their toxicity level is. And then once it's approved, move forward to applying it to children, possibly starting with an older age and then going down to younger age so that development is not severely affected if it does hurt them in the long run. Natural and herbal treatments are also becoming more commonly asked about because parents are trying to move away from pharmacological treatments. In conclusion, I found that the prevalence of ADHD is very high compared to what it was about 10 years ago. There are multiple treatment types available. There's pharmacological, behavioral, and natural herbal treatments. The preferred method right now is definitely pharmacological treatments, and of the two pharmacological treatments, it would have to be stimulants. However, a lot of doctors and researchers are starting to look into combined methods. So, combining a pharmacological treatment with a behavioral treatment, although the research found was limited for younger children, they are saying that it would be a good idea to use in older children. So, children adolescent age between 10 and 18. The biggest up and coming treatment right now are natural and herbal treatments, which would consist of vitamins and minimal mineral supplements. With those treatments, additional research definitely needs to be done. The limitations of the study, the top limitations were additional research needs to be conducted specifically for non-stimulant medications, certain behavioral therapies, and definitely natural and herbal supplements. On top of that, the other limitations would be the research that was currently available had very small sample sizes. These small sample sizes make it very hard to generalize the information and the resolutions that were come to. And here are my references. I hope that this video helps you understand ADHD a little bit further, and I hope that it uh, helps somebody decide to do additional research later on. Thank you.